Hi, this is Dr. Tom Rogers at Performance Medicine, coming to you with our weekly podcast, The Common Sense MD. That's what we need more of in this world, especially the medical world, is common sense. I want to thank the listeners, especially my Q&A sessions every Tuesday night at 7 for asking great questions. And, I like to take into account what you ask me so I can do research on it, and I need to know what you want to know about how to improve your health, especially as you age. So one of the listeners asked me a question the other night. What are your favorite supplements for anxiety and depression? And that was a great question. So I'm going to talk a lot about that today, especially anxiety. As a family doctor, especially one that's practiced as long as I have, you see anxiety and depression in your office every day. Everyone is going to experience it. I don't think anybody that I've met gets by without some of this in their lifetime. And if not treated, it can lead to a lot of medical problems, heart disease and cancer included. Plus, it can make your life miserable. So you need to treat it. And there are many ways to treat it. Our mental health system is breaking down because there's not enough providers, and it's kind of breaking down for a lot of other reasons as well. We have more stress in the world today. Everyone has different tolerances to stress. I think genetics play a role. I think diet plays a role. I think lack of sleep, lack of exercise play roles in this. Obesity plays a role in it. Having a crisis in your life plays a role in it. Infections can play a role in anxiety and depression. Look at COVID. Look at the fallout we're seeing from COVID, especially on brain function. I think the first step to take is to admit that you're anxious or depressed and seek help for it. I'm a big believer in counseling. I think psychiatrists today overprescribe medications. Some patients need heavy-duty medications. And it's really not the psychiatrist's fault. It's the system's fault. They just don't have time to talk to you. So we need to get to the root cause of the problem. So when I have somebody with a lot of problems that I think are rooted in anxiety and depression, remember, depression follows anxiety. Anxiety usually comes first. So if you're anxious for a long period of time, you're going to get depressed. So that's why I really focus on anxiety, and that's what most of my supplements today, actually all of them that are my favorites, we're going to be focusing on anxiety in the way of supplements. Now, I'm not against prescription medicine. I use them every day. But I also look at supplements because they're generally safer, and you'd always rather take a supplement over prescription medicine if you can, in my opinion. You just never see anybody overdosing or having a lot of serious side effects from a supplement. But you need to know where it's coming from, the quality of it, and they can have side effects too, but a lot less apt to have side effects. So I think they're safer, and I think they work really well, especially when you're talking about supplements for anxiety. One thing I want to mention is that for those patients that come in with anxiety and all kinds of medical problems and depression, there's a way that I approach this, and I really got this from one of my counselor friends that I tell patients who think they're the only one with these kind of problems. I always say, you are a unique individual. However, your problems are not unique. So sometimes if they realize that, it makes them feel a little better, and you're able to work with them a little bit better. So let's talk a little bit about anxiety, and please go listen to Ben's Outside the Box podcast with Jamie Winship on anxiety. It's amazing. It's actually, I think, the third one in their series. Very, very helpful and very interesting. Um, Anxiety really is fear-based. You're fearful of something. And the solution to the problem is really truth. So go listen to those podcasts because you really want to get to the root cause of the problem. I love supplements. I use medications as well, prescription medications, but in integrated medicine, we're always trying to find the root cause of the problem. So the same thing with anxiety or depression. And that's what's lacking in the psych world is time to talk to these patients and get them to kind of figure out on their own. A lot of times you can figure out your own problem, but it's nice to talk to a counselor who is based in that fact and that approach to helping people with this. So depression always follows anxiety. My favorite supplements for anxiety, it's not a supplement at all. It's called exercise. That's, to me, is the number one treatment for anxiety or depression is exercise. In fact, just this week, or last week, I guess, there was a huge study out of Harvard University that was studying, the psychiatrists were studying anxiety and depression. This was a multi-year study with 50,000 people in it, and they were exploring really the benefits of exercise in decreasing heart disease and strokes, cardiovascular disease. And what they found, what they really weren't looking for, but what they found was that for those people that had a diagnosis, a code in their medical records for anxiety or depression, those people benefited from exercise as far as reducing cardiovascular disease twice as much as people who didn't have that diagnosis. So that was really interesting. The people that had a diagnosis of anxiety or depression had twice the benefits of exercise in reducing cardiovascular disease as those that didn't have that diagnosis. And remember, people that actually have that diagnosis on their medical records, it's probably a fraction of the ones that really have it. Because, not a lot of people go to the doctor and get that put down. So think of that as a magnitude that is much greater than that. So exercise, that's my number one supplement. But and sometimes people need supplements. You can't just exercise. They need help with this. Sometimes they need medical help through medicines like serotonin reuptake inhibitors, etc., norepinephrine, or sometimes a combination. But I always like to start with supplements, and a lot of times I find that's all they need. So similar to treating obesity, sometimes you need some help with this. It's hard to do alone. So here are some of my favorites for anxiety. I love L-theanine. People my patients hear me talk about it all the time. I like L-theanine. It's actually an amino acid found in green tea mostly, but also black tea and some mushrooms. It eases anxiety. It helps insomnia. I think it helps for that mind chatter that people get. They just can't turn their brain off at night, and it interferes with them going to sleep. So I think it helps with that. Actually, a lot of people with ADD take that combined with caffeine, and it helps ADD in the morning. That's an interesting treatment. I see a lot of ADD in adults. But there's other benefits to L-theanine. It may help prevent cancer. It was found that it decreased ovarian cancer in Chinese women who drank a lot of green tea. I think they had 35% less ovarian cancer because they were green tea drinkers. It definitely helps your immune system. So I like L-theanine. I take it before I get on an airplane. I think it helps relax me because I'm a little bit claustrophobic. The typical dose is about 200 milligrams. You can take more. You could double that. It's not going to hurt you. Now, here's one I'm going to talk about that I don't know if many people know about, but I've been taking it for quite some time. And to me, it's a hidden gem. It's my favorite supplement for anxiety or depression. And it also helps weight loss. I started using this supplement for weight loss years ago, and it really helps. Can anybody guess what I'm going to say? Saffron. Have you heard of saffron? It's an amazing supplement for anxiety and depression. I think it works better than medicines like Zoloft and some of the serotonin drugs that typically are used for anxiety and depression, and without the side effects. I mean, when you use a lot of these psych medicines, you get a lot of side effects like apathy, increased suicide rates. You get a lot of sexual dysfunction from them. You don't get that with saffron. As a matter of fact, it helps it. It's what saffron? It's a plant. It's a flower that comes from the crocus flower, and it's probably the world's most expensive spice. Matter of fact, it takes 75,000 of these flowers to make 1 pound of saffron. So it's expensive. The supplements, which there's a couple of different types of it, are not that expensive though. It's powderized. But it's been used for thousands of years. And it works very well for depression, like I said. It's been found to work for memory as well. I think it works as good for Alzheimer's disease as the medications we use for Alzheimer's disease, the prescription medicines that are expensive and don't work very well, like Namenda and Aricept. I think saffron works as good at those without the side effects and not nearly the expensive. So it also helps PMS. We use it a lot for that. It helps for weight loss. We've been using it for years for weight loss because it kind of suppresses your appetite as well as evens your mood out. It increases your libido and helps even that mood out. It increases your memory. It's also anti-cancer. So I love saffron. Think about saffron. The typical dose is 88 milligram. You can take 1 or 2 a day. I take it. I love it. Another one, we're always checking cortisol levels in patients. It's on our Cleveland Heart Panel. And a lot of times if I'm not sure, if I think you have some cortisol problems, cortisol is a stress hormone, only hormone that goes up as you age. And then when it flattens out and starts coming down, you really start having problems. The thing is, it changes at different times during the day. It should be higher in the morning, lower at night, because it kind of wakes you up. At night, it's low, so you can go to sleep. So a lot of times I'll do a salivary cortisol curve where we measure your cortisol levels 4 times during the day, 8 a.m., 12, 5, and 10. It's very hard to get 4 blood tests in one day like that. But I call it the cortisol spit test. I've done it. It's really interesting if you think you have some adrenal dysfunction, whether it be full adrenal fatigue where your cortisol levels are low or it's too high and you're nervous all the time. So think about checking your cortisol levels. So whether it's high or low, we use what we call adaptogens, which are plants that can even out your cortisol levels. Whether it be high or low, they work. But out of the ones that the adaptogens, there's a lot of them, and I'll mention a few. My favorite is ashwagandha. The 2 most common ones are ashwagandha and rhodiola. I like ashwagandha because it's really better for anxiety than rhodiola is. It's a plant. It's plant-based, so it's safe. One thing about that is it takes time to work. It doesn't work really quickly. It may take days to weeks before you notice a big difference. It also helps your memory, kind of like saffron. Rhodiola, for those of you that take rhodiola, it's a good supplement too. It's a good adaptogen, but it works better for physical stamina and energy. So for anxiety, I like ashwagandha better. Now there's others that you've heard of like ginseng, which also increases memory and reaction time. It helps your brain function as well. The quality control on ginseng varies. Ginseng can also improve erectile dysfunction and increase your immunity, and it works pretty quickly. It helps blood sugars. Depends on where it comes from, though. A lot of people think about Korean ginseng, which is stronger but more stimulating, so be careful. The American form is milder. It's called Panax ginseng, and that's the form you're probably going to get around here. So think about those adaptogens. Another one of my favorite supplements for anxiety, of course, is CBD. Go to my cannabis podcast from a few weeks ago and look at that. It definitely helps anxiety. The problem with CBD is where you get it. It needs to be a quality CBD. It's like the Wild West. Again, listen to my podcast. I like the full spectrum of the whole plant, which means it has some THC in it. And for severe cases, it's best when combined with THC. You're going to have to see me and have a Virginia residence in my Virginia office, in my Bristol, Virginia office, to be able to get that. But I do think THC has, especially combined with the CBD, has some great effects for people that need it. I don't really like THC for kids, but for adults that have a lot of problems, it can work wonders and make your life a lot better as far as anxiety, pain, PTSD, mental function. Other supplements that you need to think about are magnesium, of course, which you take at night. There's many different forms. We've done podcasts on magnesium. I like magnesium L-threonate. That's my favorite. It's called Neuromag. It's a life extension product. You take it at night because it's more potent. It crosses the blood-brain barrier, and I think it's the best. The magnesium glycinate's good too. There's other supplements like chamomile, GABA, 5-HTP. I've talked about it. Valerian root. Even curcumin has some good effects on calming you down a little bit. So these supplements are helpful. But again, look at the root cause of your problem. Try to figure it out. If you need a counselor, I'm all for it. Really, I think it's great for you. But get one that will really be able to help you live your life at its maximum to the fullest. And help the root cause of your problem, which may be lack of exercise for one thing, poor diet, a lot of stressors that you put on yourself. It's hard to manage stress. You need to kind of get rid of stress. Decrease your sugar. Sugars are just terrible for you in every way. And also look at your hormones. Your hormones have a lot to do with anxiety, especially I've found in females that enter those premenopausal years. Your progesterone gets low, and it causes a lot of sleep problems and anxiety. Progesterone's great for relaxing you. Men, you talk about low testosterone. If I ever see a middle-aged man come in my office and he's depressed, he usually has low T. He doesn't have a Prozac deficiency. He has a testosterone deficiency most of the time. And testosterone does not make you, it doesn't overstimulate you. Actually, it calms you down for the most part. It doesn't make you over, aggressive or anything like that, done in the normal doses. So think about looking at your hormones as well. So there's a lot of great supplements for anxiety and then depression. Look at saffron. I think saffron to me may be the clear winner for everything. But anyway, any questions, please don't hesitate to come see us at Performance Medicine. And I like your questions. Please ask me things that you want me to address that may help your life and your health go better in the future. Thank you. This is Dr. Tom Rogers at Performance Medicine.